Every smile has a story. For Amin, it began with a quiet pain, one he thought he could ignore. He came to Malaysia to work hard and support his family back home. But lately, even the simplest task, eating, smiling, talking, reminds him of the tooth that hurts. He fears the worst but convinces himself there's no cheap dental option to get it checked. Days go by. The pain grows sharper, yet Amin's life carries on. He thought he could bear the pain. The pain is unbearable. This time, he knows he needs help. He walks into the nearest private dental clinic hoping for relief. But courage fades when faced with reality. He lives quietly, carrying the same pain and a heavier heart.
Usually they don't, because they will be waiting until the point where it become worse or the pain become worse, and even then most of the time they are approaching a medical doctor rather than approaching a dentist. The fear of costly treatment is there, so usually they don't. The main reason definitely language barrier, and then some miscommunication, and transport issues, and their own cultural beliefs maybe. Basically, for the foreigners, it's not their first language, so they come here and then they learn bahasa Malaysia or English, right? So they often misunderstand the cost and the fees and the whole procedure and everything, so maybe that's the reason.
Every problem deserves a solution, and sometimes it begins with understanding. In the expert's view, dental education isn't just about learning, it's about serving the community. The expert highlights the wide range of treatment options available, from simple fillings to root canal therapy, all supervised by qualified specialists. The expert explains that the fees are intentionally kept low so that even migrants or refugees can afford proper dental care without financial burden. By offering accessible treatment, the dental school ensures no one is left behind, no matter who they are or where they come from. We are pleased to share that BIDC has treated 176 migrant workers from the month of February to October 2025.
Basically, the dental treatments are very expensive, and foreigners are not eligible for the local subsidies. For example, when a Malaysian citizen, they go to government clinics, they get very cheaper treatments, but for foreigners it's almost as same as the private clinic. There are many public and private dental schools and teaching schools lah. Basically, they used to provide dental treatments with very low cost, where the students will be examining the patient under supervision of the specialist, and also treating the patients under supervision of the specialist. Those approaches are happening in few places, as well as some outreach programs are also organized by these NGOs like Malaysian Red Crescent Society, as I mentioned before, and also dentistry in needy, where they used to go to, when I was working in private, I used to go to Penang, near the Masjid Kapitan there, where we will be setting up the dental chairs and portable scaling unit and portable high speed unit, portable suction units, and then we used to do very minimum treatments, the very basic treatments for the patients who are walking around the street and everything. And for the Myanmar refugees, we have collaborated together with the medical doctors, where we have examined and also provided some treatments by going to their own kampung lah, meaning their own village. Yes, yeah. Maybe we can reinforce whatever the ways we are already having, meaning outreach programs, and doing treatments in university, public and private universities and everything. The extra what we can do is maybe we should make brochures or pamphlets with in multilingual, or maybe the same language as the foreigners first language. And we also should make sure it's reaching their community, so it's easier for them to read and understand the cost. Together with the cost, we should provide the brochure, so it's easy for them to understand, so they will make a first step to come for the examinations and the treatments. Yeah.
Accessibility begins when we care beyond boundaries.